Welcome back to Life in Review. I'm Josefa Salinas, your host. Telemedicine. Oh, what is it? And how important is it for us right now? Well, I love telemedicine, and here to talk with us about it today, Dr. Jason Hallock. He's the Chief Medical Officer at SOC Telemed. Go ahead, Doctor. Can I just call you Dr. Jason?
Yes, absolutely.
Okay, sounds a whole lot more friendly. So, Dr. Jason, do tell me, what is telemedicine and why is it going to be so important, especially right now?
Sure. Well, let me just tell you, I run our physician practice at SOC Telemed, and we bring an interesting perspective to telemedicine that sometimes you might not hear as much about. And we provide over 200 specialist doctors in critical care, neurology, and psychiatry to provide care in hospitals nationwide. We also have a telemedicine platform that's used by over 550 hospitals across the nation, and that connects doctors and many other specialties to patients every day, including hospitalists, ER doctors, cardiologists, infectious disease specialists, and many others. So telemedicine is really about making the connection between a patient and the doctor in a virtual manner. It started 20 to 30 years ago, but it didn't look like it did today. It does today, 30 years ago. Today, telemedicine frequently involves a video connection and is helping keep both doctors and patients safe every day.
Wow. So let's break it down in layman's terms. When we're talking about telemedicine, does this mean having my doctor give me a call on a computer and I see him and he sees me and we're possibly having a visit like I would in his office?
Sure, absolutely. So many primary care physicians have gotten up and running with telemedicine quickly. So, yes, you can probably see your primary care doctor today by telemedicine. If you need care, I would recommend that you call them. It's many times done through a video connection on a laptop or a web-enabled device like an iPad or tablet, or even a mobile phone. In the hospital setting, it works a little bit differently, but let's just say you arrived in the ER at your local hospital, you would register as normal, and then trained staff would bring over a telemedicine cart or another, again, web-enabled device like a tablet or an iPad. And next, your ER doctor or the specialist you need would appear on screen and be able to see you and hear you and work with the hospital staff that are standing next to you to provide the care that you need. Many times this only takes minutes.
Now, one of the things with our current situation that I was thinking is that if they've told you to, stay at home and, watch your symptoms because you have something that might be a virus, maybe not, telemedicine could play an important role if the doctor could check in on you without actually coming to see you, and you could stay in your isolation.
Absolutely. It's being done every day in that manner and very effectively. The important things for people to understand are what are the symptoms of coronavirus and what are the severe symptoms. The normal symptoms include fever and a cough, typically. And for those, you can call your primary care doctor, and they can see you and check in on you at home. More severe symptoms, of course, include trouble breathing. That's the most serious symptom that we're seeing, but also chest pain and chest pressure and confusion or problems arousing people or family members, or in some of the worst cases, blueness on the lips or the face. For those, you would want to call 911 for, but make sure to tell them that you think you or a family member might have coronavirus.
Now, when we're talking telemedicine and we're talking about going over a computer and, my doctor, seeing me seeing him or her, how safe is this? I know a lot of people worry that, my information might be compromised. Who's going to get my information if it's up here? Not realizing that when you go to the hospital, all your information's on a computer anyway. But how do I feel more safe at home with this whole idea of being on the internet?
Absolutely. I think patients should feel very safe regarding telemedicine today. If you're engaging with your regular doctor, all your information remains in the office just like it always had, and it's really just a conversation that you're having that's not taped or recorded. In the hospital setting, it's also not taped or recorded. However, the connections are typically, we say, HIPAA compliant, secure, so they can't be hacked by any means. But telemedicine has been around for a long time, and patients should feel very comfortable and safe utilizing it. It doesn't replace all the bedside care that we'll need today or in the future, but many things can be done by telemedicine. And in the hospital setting, if something else needs to be done, it's supplemented by professionals at the bedside.
Yeah, I remember one time when I had an ear infection, I think it was an inner ear infection, and I had them before, so I kind of knew the symptoms. I was able to reach out to my doctor online. We didn't actually see each other, but we talked, and so I, put all my symptoms in, and I said, "Remember when I had this, on such a date? Here are my symptoms again. What do you think?" Then he replied, asked me a few more questions, and then called me. We talked about it, and he was able to give me a prescription, that he sent to the pharmacy, and I didn't have to actually go into the office. So is this the kind of future that you see for telemedicine?
Yes. I don't think that all care will be provided by telemedicine. Certainly much more than is normal will be provided during this infectious disease crisis. The greatest benefit to the patient is the use of their time, whether that be at home or even in the hospital setting. In the hospital setting, you can get specialists at the bedside via telemedicine much faster than you could if a doctor or specialist had to drive from another hospital to see you, for example. And in the hospital settings, many of the technologies have what we call peripherals, where a doctor can actually look in your ears or your eyes or even listen to your heart and lungs. And as your example is a great one, where many times we don't have to look in the ear to know whether or not we need to treat.
Now, when we're talking about all this telemedicine and the whole idea of moving this concept forward, I know a lot of people are immediately thinking, okay, but is my insurance going to cover this? And I know California is a little bit ahead of the game when it comes to telemedicine regulation. So talk to me a little bit about that.
Well, the first thing would be to check with your insurance plan, but almost every insurance plan has said that they are going to cover telemedicine visits during this crisis, and I hope after. Medicare recently released many of the restrictions on telemedicine so patients can get care from their doctors at home and specialists in the hospital setting. And so it's widely covered today.
Yeah, even with Medi-Cal and even private payers are reimbursing for this video conferencing, which I think is a great idea and is definitely moving the whole concept forward. And I know right now, if I wasn't feeling well and I wanted to speak with my doctor, I'd be very hesitant to go into, the waiting room at an urgent care where there's like 30 people and people are coughing and, really, really sick, and maybe I just have something that's not quite so bad. I would love an idea to be able to speak with a doctor, have the doctor look at me look at him or her, and be able to do this without actually going into an urgent care or an emergency room where you sit there and you just feel you start feeling really anxious and overwhelmed just being around other people who are much more sick than you.
Sure, absolutely. There's no safer place today than home. However, if, God forbid, anyone has more severe symptoms and needs care in the hospital, they can know that telemedicine is there to help them too.
Can you give us a quick website or somewhere where people can go for more information about telemedicine?
Sure. You can visit our website at soctelemed.com. And if anyone wants more information about how to stay healthy during this pandemic, I recommend they go to the CDC website at cdc.gov.
Well, thank you so much for being with us. And as this technology grows and blossoms, we sure would like to have you back to talk about it.
Thank you.
As we move along in this morning, let's look at some statistics about small businesses. The coronavirus has hurt 90% of small businesses in the United States. A new survey conducted by the Commerce Department shows that a little over half of small businesses in the U.S. say they've experienced a large negative effect from the pandemic. Now, if you're one of those small businesses, there are options for you. There's federal and state loans. There's the U.S. Small Business Administration Economic Injury Disaster Loan, or the EIDL. Then there's EIDL advances. There's the CDC Small Business Finance Emergency Loans, Facebook Small Business Grants Program, Pacific Community Ventures Small Business Loan Program, Lendistry Loan Programs, Axion Small Business Loans, Opportunity Fund, AMPAC Micro and Refinance Loans, Exim Bank, American Bankers Association COVID-19 Assistance List, an eater list of relief funds for restaurants, bars, and food service workers. All of this information can be found at lbunited.com. Click on the business tab and then just scroll down. All of those resources are there, as well as the staff at LB United. Although they're located in Long Beach, they have information for Riverside and Ventura counties, along with Los Angeles County. So make sure you check them out. lbunited.com. They got the info for you. Coming up next, we're talking clubs in the 90s. There was nothing like it.